We are using the adjustable lateral head positioner. We now have a consistent methodology for positioning the patient whereby the patient doesn't move, and we can ensure that there are no pressure points. So our approach is more standard than it ever was. These robotic cases present a unique problem in that the anesthesia team and the surgical team are often removed somewhat from the patient because we've got a robot docked around them, and thus we cannot really get too close to the patient. So once they're positioned, the patients stay somewhat static in their position. We can ensure that there's no downward pressure on their ear or on their eye, and they don't have a tendency to drift. Not one patient is the same. We have patients who have a BMI in the 20s, and we have patients who have a BMI in the 50s. Each patient is unique, and thus having a multi-layer that you can remove to allow it to raise or lower the head to keep the head neutral and the atlanto-occipital position neutral is ideal. We want to make sure that we prevent any stretch on any muscles whenever the patient is properly positioned. After a 2, 3, 4, 5, 6 hour case sometimes, I find that there is no skin breakdown. I find that the patient has no induration on their face or anything. So it works very well. The patients don't have a tendency to drift. They hold their position. And even when I'm docked in a robot and I can't get close to the patient, I have a degree of confidence that the patient's not going to move or drift on the pillow and thus have a pressure injury. So this was a game changer for us, truly.